This is Boomer Life on CIL 650.
Welcome back to the program. Sterling Fox with you here on CIL 650, joined in studio by Dr. Chris Coburn, one of the many professionals down at Falls Creek Healthcare Center in Vancouver, as well as being the president and CEO of SmartShape. Dr. Coburn is a laparoscopic surgeon, and on this early portion of 2015, we're talking about weight loss. And it's very timely of you, Dr. Coburn, to pay us a visit. We've talked a little bit, and by the way, friends, Dr. Coburn has brought some visual aids to the program. Now, if you're driving along, listening to us on the radio, this isn't going to do you much good. But if you get home and you want to see what Dr. Coburn has, and he's brought an actual stomach, not an actual stomach, it's a plastic one, but it's very similar to what you and I have inside us. And so we have video podcasts of each and every episode of Boomer Life available at CIL650.com. So if you would like to have a look at what Dr. Coburn is showing as well as talking about, just pop by the website when you have a moment, and the video as well as what you're listening to is also available. So Dr. Coburn, we talked a little bit about the lap band weight loss surgical procedure. Next on the list is something called the gastric sleeve. Away with it, please.
All right, so the gastric sleeve procedure, sort of the new kid on the block, I guess, or new thing on the menu as far as weight loss operations. And the same concept of allowing people to feel satisfied with smaller portions. It's not about what you eat, it's always about how much.
Right.
And all of these procedures, lap band, balloon, and gastric sleeve, all allow you to control portion size, okay? So with the gastric sleeve procedure, again done laparoscopically, so no big cuts, not a lot of pain afterwards, but basically we go in and we divide the stomach. We actually physically divide and remove probably about 85% of the stomach itself, and it's removed. And you're left with a tube or a sleeve of stomach about the size and the shape of a banana. Is the way to think of it. Okay, so and what happens there is that sleeve again holds that bite of food up in the upper part of the stomach, allowing one to feel satisfied, to feel full if you want, but with a smaller portion of food.
And again, giving the brain the appropriate signals that there is enough food being consumed.
Yes,
okay.
Yes, yeah. Now, different than the lap band procedure, there is no device involved.
Right.
So there's nothing that's sort of left inside that needs to be adjusted or that could be adjusted. So it tends to be an operation that's done without the need for post-op adjustments and care, which for a lot of people, especially if you live in some more remote communities,
right.
Or if you're somebody who doesn't want to have to be committed to that type of post-op care, the sleeve is probably a better operation. It's an operation that does actually require a couple of days in the hospital because we have to watch you. There's a slight risk, small, but there is a risk of where the stomach has been divided, that staple line that we leave behind could leak. That's probably the biggest complication associated with the sleeve. Again, we haven't had that happen, but it can happen, and we need to watch people carefully to treat that.
So a couple of days of observation is required before you're comfortable to let them go.
Correct.
Okay. Which of the two, the gastric sleeve or the lap band, is more popular these days?
It probably depends on where you go. There's certainly more lap bands done than sleeves in Canada at the present time. And that's a mix of private and public, and is sort of subject of another discussion. But there are certain, the sleeve is increasing in popularity at the expense of the gastric bypass as much as anything else, because they both involve stapling. They're similar procedures. They're sometimes available publicly, the sleeve, whereas the lap band is not. The sleeve is more, I suppose, more popular because the weight loss is a little faster with the sleeve than it is with the band.
Okay.
Right? So for people who want to lose weight or need to lose weight faster because they have bad diabetes, sleeve may be a better operation for them.
Oh, okay.
So with the lap band, we're looking for people to lose maybe 1 or 2 pounds a week. With the sleeve, it's certainly going to be faster. It might be 3 or 4 pounds a week. So the lap band individuals will lose weight for up to 1.5 years. The sleeve patients may lose the weight that they're going to lose within 1 year.
Okay.
When you look down the road at 2.5 years, lap band, sleeve, bypass, all basically have lost the same amount of weight, just a different rate of weight loss to get there, sort of the tortoise and the hare type thing.
Okay, so between the lap band, and we'll talk about the balloon in a second, that's option 3, but so far between the lap band and the gastric sleeve, are they approximately the same cost to the patient?
The lap band procedure is a little less expensive because we don't have to keep people in the hospital.
Oh,
so
right,
a
of
couple
course.
of days of hospitalization
Sure.
adds to the cost, but aside from that, they're relatively equivalent in cost.
Now tell us about the balloon.
Okay, if I can just give you what's important with both of these procedures,
sure.
though, is the
Okay,
I keep coming back to it, but it's what's so important to us is the follow-up. So these programs and what we deliver at SmartShape are programs: a gastric band program, lap band program, and a sleep program, because we want people to be engaged with us, work with our staff, get the counseling and the help they need. So we want to think of them as much more than an operation.
Okay.
The gastric balloon is the third option. It's a procedure that is done endoscopically, meaning there is no actual incision. Individuals are basically put to sleep, and we look down in the stomach with an endoscope or gastroscope, and we inflate the balloon and want that balloon to sit in the very upper part of the stomach. And the balloon holds about 600 cc's of saline, salt water. We want that balloon to stay in the upper part of your stomach, again, leaving a little bit of stomach, that pouch that I keep coming back to.
Right.
That pouch, which is the effective part of the stomach when it comes to weight loss. People with a balloon will eat, bite by bite will fill that pouch, and then the food goes around the balloon rather than through the middle of the band, and now down through the stomach normally. The difference with the balloon is that it's a temporary procedure. So after 6 months' time, we have to go back in again and remove the balloon, and that's because being inside the stomach, the balloon is exposed to the acid, the digestive acid.
Of course.
And if we left it in there much longer than that, there's
would
a risk
disintegrate?
of it leaking. Yeah.
Okay.
So the fact that it has to be removed after 6 months limits in some ways the applicability of the balloon. So for us at SmartShape, we recommend the balloon only to typically younger individuals, usually women, lower BMI, no more than 32, but importantly, who've only had a weight problem for a short period of time. Okay, it's not the chronic disease we see in the majority of patients, but typically a young woman who maybe had a baby and put on 25 or 30 pounds just wants to get rid of that fat that she gained.
Lose the baby weight.
Right, exactly. Yeah. So the balloon is ideal because if we can get that weight off and the 25 or 30 pounds is in the range of what we see with the balloon, then we have confidence that they can return to the eating habits that they had before they had the baby and had a weight problem, and can keep the weight off. And that's what we're most interested in, is maintaining the weight loss.
I suppose, though, and I have to ask you this just as devil's advocate, if nothing else, Dr. Coburn, if you have a young woman who's just had a child and is having difficulty losing that baby weight, and of course life gets awfully busy and sleep becomes pretty precious, why can't that young woman just exercise her way back to her pre-baby weight?
Yeah, and she may be able to, and certainly most of them have tried that. So they've tried the diet and exercise. Sleep is a whole nother discussion around weight, but they may have tried that, and it's not the first line of treatment.
Of course.
But if they just can't seem to get that off, it's been within a couple of years and they're frustrated, the balloon really in many ways is like a mechanical diet. Right? It really, I mean, if you don't change the way you eat, if you don't chew your food well and eat slowly, then they're going to have issues potentially with regurgitation or vomiting, and we don't want that. So the balloon forces them.
Okay. And I guess what I'm aiming at here is, as we are talking here on early January, and people listening to us, if it's not effective, you're not talking about me necessarily, but each and every one of us knows someone who has a weight issue. Yeah. And the weight issue is generally complicated by diabetes or high blood pressure. I mean, it never in and of itself, being overweight always usually invites other complications, doesn't it?
Oh, well, yeah. I mean, it's very common. We see lots of people who may be overweight or obese and don't have health issues, but they have other issues. They have issues around confidence, around mobility, and so on. And we may not be able to measure the effect on them that we can with something like diabetes.
You know, and we made kind of a remark earlier about fat jokes still being socially acceptable, but you know, we're talking about people here, and some of whom I think a lot of us are dismissive of obese people because we see them as people who are irresponsible, who can't look after themselves,
Lack
who
discipline.
are lazy,
Yeah.
and all of that stuff. And in many cases, they have no control.
Yeah.
And that's important to know. Tell us why.
Well, because they don't. I mean, we understand there are complex reasons why people are overweight. It may be the genetic issues, it may be environmental issues, it could be psychological things that have happened to them in the past. There's lots of things that can happen that can promote weight gain.
Right.
All of those are unimportant. The important thing is that once you've gained the weight, it's very difficult, if not impossible, to lose a significant amount of weight with anything other than surgery.
Interesting.
So we need to be able to make ourselves accessible and get people to understand that these options are there because they work. They're effective, they're safe, and they get people back to a state where they feel good about themselves again.
Our guest is Dr. Chris Coburn. He is a laparoscopic surgeon, president and CEO of SmartShape, and one of the good guys at Falls Creek Healthcare Center here in Vancouver at 555 West 8th Avenue and online at fallscreekhealthcare.com. Quick break here, and we're back with lots more.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIAL 650.